participants. So, sure I can do this. All righty. So, I don't know why I'm not going forward here, but I will try. So, supportive connections, our mission is to assist people who are maybe in crisis or have needs for social services from becoming involved, re-involved, further involved in the criminal justice system. So above all, we're kind of we are a deflection program. So we focus on some of the causes of people that are in the criminal justice system, such as the need for substance abuse and mental health treatment. Deflection being trying to keep people out of the system from being involved in the system. So that kind of at-risk definition, and generally those that are struggling with SUD or have mental health concerns generally can fall under that at-risk category. Not going forward. There we go. So who do we serve in this? We serve adults, anyone 18 years or older. While our young people do need services, they are not particularly a target of this, so sometimes they can be indirectly involved. And they have to have a connection to the city of Ann Arbor. And that's pretty broadly defined. I think we most times can work out someone having a connection to the city of Ann Arbor. So if they live in Ann Arbor, and that includes those that are temporarily maybe living with family, friends, shelter, hotels, parks, streets. You don't have to have a permanent residence necessarily to be considered to be living in the city. So dwelling here, working here, that's any activity. Work is any activity from which you derive income. It can be unreported income, and it can be panhandling income, even whatever income that they may be qualifying for. So if they're working in the city of Ann Arbor, that's broadly defined. If they attend Ann Arbor Public Schools, or they have a child who attends Ann Arbor Public Schools, that connection as well as a connection to Ann Arbor. And if they have a court case in the 15th District Court, while we're not directly a court program, if people are involved or connected here, we can make that connection. So some kind of connection to the city of Ann Arbor. And what we do is we offer trauma-informed care, and we focus on the client. We're non-judgmental, non-coercive. We are a voluntary program, and we try to tailor the needs to the individual. We have our case manager who assists with working with the individuals, and we try to work within existing community resources as possible. So many people that are on this call are resources we may use and may need if we get a call for someone who needs services. So we're not looking at impeding any established relationships. So if somebody already is working with an agency, we're not looking to damage that relationship or take it over. We are just looking to fill in gaps and help where we can. Where gap fillers, provide assistance. We work closely. We have a small group of community-based treatment and service providers that we are working with directly. They're part of our core team, and we meet regularly to work on cases. A couple of those people involved are we have work with and have contracts with Home and New Vision and Dawn Farm. And we also try to network and meet with as many people in the community as possible to know more about resources. Among other things, being a deflection program, we've kind of become a resource for the city of Ann Arbor. So if someone shows up at the city clerk's office and has an issue, or someone's the police agencies or whatever, they kind of refer them to us and say, where they can help. We have a lot of wonderful resources in this community, and sometimes people just don't know about it. So they'll call and say, I have this problem. What would you recommend? And we kind of become a referral source as well in that way. So I do have some financial ability to help people that are labeled at risk of become involved in criminal justice. So some of the things we have would be wonderful to give to absolutely everyone in the community, but unfortunately, we just don't have that kind of funding to be able to do that. Like I said, we will work with individuals who are engaged with other community providers. They don't necessarily have to be starting from scratch, and we will help out as much. So, show you the money. Where can we help? What can we do for you? So we can help provide substance abuse treatment. As I said earlier, we have contracts with Dawn Farm and Home and New Vision, and we can help pay for substance abuse treatment. Yes, we may try and get someone to make sure that they have other sources of funding to exhaust those first, but if they can't, we will help out and we'll help direct them through the process. Sometimes we have people that are in the county that don't necessarily live here or have resided in another county and medicated in another county, and things can get tied up. And so we can help provide for substance abuse treatment in those sort of situations, and help pay for residential and as well as transitional housing. A lot of insurance does not cover transitional housing, and we can help pay for transitional housing. We have money to pay for mental health treatment as well. Again, we have a contract with Home and New Vision to be able to help with that and help direct people that way. We can handle educational fees and materials, again, for those who are at risk in justice system involvement. So if they have to pay for their GED testing, fees, materials, I know there's other agencies who help with that as well, but if there's a fee that they have to pay that way, or for an educational program or work program, we can provide with that. We can also help with textbook assistance up to $300 for an individual that's at risk. We have some money to be able to help with transportation needs. We are, by the grace of Ann Arbor Transit Authority, a fair deal provider. I know many of you are as well. I have some bus tokens and things of that nature that we can help with, so we can help with transportation that way. We cannot pay car repairs, cars expenses, things like that, but we can help with those. We can help with identification procurement. So if someone needs funding to help get their ID, their license, that situation, we can pay for the license reinstatement fees. We cannot pay for back fines or costs that are associated with courts, but we can help that way. I know the county does IDs for people that are, discounted, but sometimes for some people, $5, even at the discounted rate, is more than that they can afford. So we can help with identification procurement. We've helped people get birth certificates, different things like that. We have some money to pay for mediation services through the Dispute Resolution Center if we have people that are in the need for those services. And then we also carry a stock and supply. You'll see I have a very small office, but we have things all around. Narcan, sleeping bags, hygiene kits, different things that we try to provide if we see a need is based. If you have an agency who you're working with and there's some kind of an item like that that you need and your budget has run out, let me know. We may be able to assist that way for just basic needs like that. So we do have that. We provide the Narcan. There's a Narcan vending machine in City Hall. We are looking at expanding those efforts. So harm reduction is also something that we are focusing on as well. And we can help with security deposit assistance. That's for people working with one of our partner agencies. And again, it has to be somebody who's at risk, who's currently homeless, and try to getting them into housing. We've been helping with deposits of up to $500. So we've helped through the shelter 12 individuals to date get with their getting more permanent housing. So it is limited. I cannot pay back rent. That's the call I get probably most of all, is like, everybody needs rental assistance these days. It is if I could solve the affordable housing crisis in Washtenaw County, I would, but I do not have that kind of money and those kind of resources. And we all know that that's the biggest probably challenge we have right now as a community. But we have some ability to help with those. So that's how we can help with certain things. Again, we're a voluntary program. We're not connected with the courts, the police department, anything like that, though we may get referrals from those agencies. Sometimes we get people who just see our card out and about and call and refer themselves. So we have gotten a number of referrals from many different sources in the community. That's been very gratifying. And anybody can make a referral. We have the ability to do it online. We have a web page that's web-based referral, email, and then a phone. And our office number is on here. It's 794-6934. If you think someone might qualify, rather than refer them, directly to call, maybe you want to call and talk to myself or the case manager. We can tell you if we can help and maybe what we can help with prior to you sending someone over. We are always happy to do that. And again, there's our contact information. I think Ambrose will be providing this, but please feel free to call us. If we can't help, hopefully we can direct you to someone who can. If you feel like you could help us and we could work together, we'd love to meet with you and talk with you. Thank you.
Karen, it looks like we have a question from Anna.
Hi, yes, thank you. I just thanks for the presentation. I just had a question. Is this a deflection program and forgive my ignorance, but is this a deflection program in the sense, can you hear me okay?
Yeah, I can.
Okay. Is this a deflection program in the sense that if someone has, pending, I don't know, like the prosecutor is considering whether or not to bring charges for some like low-level misdemeanor, can a person participate in case management with you all and then potentially get their charges dropped? Is it deflection in that sense or not?
No, that's generally divert. So the kind of the terminology of it and having done both, it's just sort of a back and forth of words, but those are generally called diversion programs. So if somebody has a case pending and they do a program and they get it dismissed, it means they've had some kind of contact with law enforcement in some way. So it could be either through law enforcement, through the prosecutor's office, or through the courts to do those kind of things to not end up having charges. So no, we're not that kind of program because we've not connected with the court or police. So the idea is we're gonna step in before somebody gets involved with the criminal justice system or further involved. So we're just there to help our services are to help people prior to anything like that. Now, I will say we do have people occasionally that are involved in the justice system, but where we don't want to get involved is with the diversion programs. If someone doesn't complete those case managements, then you have to report to someone like the police or the prosecutor or the court and say, hey, they didn't do this. Now what's going to happen next? And we're not involved in that way because we don't report to courts. So while we may work with somebody who's working with the public defender or the court, we're not reporting back to the court whether or not they're doing what they were asked to do. So an example might be if somebody does have something in court and they need, we can't pay their fines or for their treatment that way if it's court ordered. But say somebody has an arrest for a drunk driving and they're concerned, like they really want to get treatment and they haven't been ordered yet. They haven't gone through court. They're not on probation, but they really want to start addressing this problem ahead on. We can help direct with those sort of services. So we are, like I said, we don't want to be in the position of having to report to a court or anyone else as to whether someone is successful or completing. Does that make sense? Anna, did that answer your question?
Yes, thank you so much.
Okay. Any other questions? And again, I thank you. It's been kind of a crazy day, so I appreciate everyone being here. And if you, we can't do car repairs. So we can help somebody get a license, things like that. We cannot, I don't have money or funding for car repairs, unfortunately. We have a very limited budget. We've kind of talked to, when we first were doing this program, we talked to some of the agencies how we might best spend some of our funds. And this is why we came up with sort of what we did over time. If there's no other questions, always anybody that you have our contact information, please feel free to call us anytime. Thank you.
All right, thank you so much, Karen. We'll give Hogan a couple minutes to prepare before we move on.
Thank you, Ambrose. I'm ready. I can start now.
You are whenever you're ready, you're welcome to start. Thank you so much.
Perfect. You guys see my screen?
Yes, we can see it. Thank you.
Perfect. Okay. Hi, everybody. My name's Hogan Lepore. Just recently hired at Corner Health Center. Communications and media coordinator here. Filling in for Ashley Anderson, who's our outreach manager. So just a little backstory. First, a little selfish plug. Follow us on Instagram, Facebook, Twitter, TikTok, and on our website for all of our updates. Definitely something that we keep updated. So if you want to know more about what's going on, what program we have, please follow us. So we're on North Huron Street, right in downtown Ypsi, right next to Riverside Park. So our mission at the Corner Health Center is to inspire 12 to 25-year-olds and their children to achieve sustaining healthy lives by providing judgment-free, affordable health and wellness care and education. So a little bit about our backstory. We were founded in response to the high rate of teen pregnancy in Ypsi at the time. And we set up shop firstly in an old Ypsilanti high school, which is somewhat full circle as now we have school-based healthcare programs within the Van Buren School District. So comes kind of full circle in that sense. A couple of our founders are listed here as well, Joan Chesler and David Scher. And just more backstory about the Corner Health, about how we moved into the building here in downtown Ypsi, expanded our services, increased patient load by 20% the first year, and we're continuing to climb, continuing to get more patients, which is phenomenal. So yes, we began offering Medicaid, managed care, and assisting patients with applying for health insurance. We also have a corner store that we opened. It provides personal care items, clothing, and household goods to patients in need. I believe Andrew Lewis is in this meeting as well. He is a care manager for us at the corner as a part of the corner store. And we launched a food pantry and patient assistant fund as well. And we're expanding services to include mental health in addition to physical wellness. So we'll get into that more as well. So we have judgment-free services. We don't discriminate against any identity, protected or otherwise. Services are provided regardless of insurance status or ability to pay, and supportive of IDEA, inclusion, diversity, equity, access. So our high quality care, there's many different things that we serve to our patients at the corner: physicals, vaccinations, reproductive health, OBGYN and pediatrics, mental health programs and counseling, diet, nutrition, hormone replacement therapy as well. So paying for your services here at the corner accepts many private health insurance plans and all public health insurance as well. We will see young people whether or not they have insurance coverage, staff members, they're available to help our patients apply for insurance. As we mentioned, our patients are usually younger, so if they need assistance applying for insurance, we can help in that way as well. If a young person is uninsured or choosing to not use their insurance, they are responsible to pay for the care that they receive. Services offered on a sliding fee scale based on the patient's income. And the corner will see young people regardless of their ability to pay, which is a very nice service that we offer. So our providers that we have here at the corner include a couple different types of physicians, pediatricians, psychiatrists, family practice, nurse practitioners, nurses, social workers, nutritionists, and health educators. So all of those are in our building and have offices that can see our patients on a daily basis. So some of the services that we have: general medical care, reproductive care, pediatric care, mental health services that we have. We also have behavioral health services as well. Then confidential services. Parent consent is not required for reproductive, STI, HIV testing, or mental health visits. And then as I mentioned previously, we have other care as well, like physicals, vaccinations, sick visits, TB testing, and many other diagnoses or treatments for any illness. And just kind of breaking down more of what we do with reproductive care: birth control, testing for STI, HIV, pregnancy testing, prenatal care, maternal infant health program, and home visits as well. That falls into that maternal infant health program. And we also have counseling with licensed therapists, therapy, case management, crisis intervention. And another thing that the corner has that's really beneficial is our therapists. There's a wide array of therapists that we have. We have a diverse group of therapists. So we may have a therapist that might fit your needs and who you might identify with. And psychiatry as well, diagnosis and medical reviews, University of Michigan psychiatrists and residents, students that always come to the corner. And then health education, we have the health educator, Riley Anir, who works upstairs. So health education in the clinic, health educator works in the clinic, works with clients one-on-one and in groups. And then in the communities with Riley Anir is what she front heads at the corner. We have a theater troupe, peer health education program, and health education workshops. A lot of that health education workshops will be done in the summer. We have a lot of summer programming going on right now, including one of our Healthy Youth, Healthy Futures program, where our young members will learn to prepare food, cook it, make it, and all on a sensible budget, kind of giving them an opportunity to make their own food on a budget that's not, way overpriced. And we also have support services. This kind of goes back to what we were talking about with the corner store and our pantry. We have health insurance application assistance, as I talked about, the corner store, women, infants, and children supplemental food program, nutrition education, home visits, civic support groups, and then if there is an instance where transportation is needed for members of one of our programs, we may be able to give bus tokens or Uber. There have been instances where we just haven't been able to do that, but in some cases we are able to offer transportation. And that falls into the same category as well in theater troupe. I know theater troupe, they have instances where it's a lot of high school students and I'll get into that later as well, but they will need transportation, so we offer that for that specific program. And then here are hours, pretty standard. The only real outliers is Tuesday, we're open until 6, and Wednesday, our clinic is open at noon. You can make an appointment or walk in. We have same day appointments available. And then this is what I was talking about. We have a couple opportunities and groups that our young people can get involved in the community. Theater troupe is a big one. Theater troupe is run by Joey Albright. He is our director of theater troupe. So they recruit all year. They usually meet during the school year. In the summer, we have a break. So right now we're in the break, and then we'll gear up and get ready for more recruiting. You learn a lot about, if you're interested in acting, obviously this is the group for you, but also within that, it also has different health tips, and at the meetings you learn about different health programs and different ways to, just overall be a better you. Help to develop new plays, skits, perform skits on healthy topics. These two pictures were from a high school that we presented in Ann Arbor. It was over 100 students sat down and watched us perform. It was a really great experience for our members. They, just had an opportunity to perform. And the members can also receive a small stipend for attending troupe meetings and performing. So if you are interested, please contact Joey. I can put his email address in the chat as well, just so you guys have that information if anybody's interested. And then we also have youth leadership council, traditionally made up of local high school or college students. It is currently open to all. We don't discriminate, college, high school. If you're willing to be a part of our organization, we're all for it. We meet weekly year-round with small breaks. They help advise the corner on its programs, policies, and services, kind of giving their perspective. It's not always about we are obviously making the programs, and we want to hear the perspective of our members for sure. They'll select projects to work on as a group. Members receive a small stipend as well for attending YLC meetings. And the YLC is also run by Ashley Anderson, our outreach manager. And her information is here, but like I said, I will put her email in the chat as well. And then once again, follow us on social media and on our website. We have a lot of different things going on out on all those websites. So it's a great way to get involved and see what the Corner Health is doing in Washtenaw County. As for questions, if you do have questions, I want to make sure you get the most accurate answer as possible. So being new here, I'm not going to be able to answer everyone's questions, but I can give you all an email. Ashley Anderson can give you a lot more information about different topics that you might be interested in at the corner, and she can provide those, and I can put her information in the chat as well. Does anyone have any questions? Anything I might be able to answer?
Well, hearing none and seeing none, thank you so much for coming, Hogan. I know it can be sometimes challenging to do things last minute, and I think you did really well. So I wanted to really thank you for coming out today.
I appreciate